Welcome to Newspresso. Here is the top story in the past 6 hours. The story begins in a town. A 37-year-old mother carried a pregnancy. Her doctor told her there was no emergency, a calm, almost casual reassurance. But the next day, sudden spike in blood pressure and severe headaches pushed her into preeclampsia. With no access to an abortion clinic, Tiara was in place where her life was at stake. She didn't survive. This isn't an isolated incident. ProPublica uncovered several cases of women with underlying health conditions. They died because they couldn't get timely abortions. The pattern is chilling. Doctors dismiss urgent medical needs. Then the patients suffer fatal consequences. The agency's report shows that the barrier isn't just geography, policy, and insurance coverage. The agency's report indicates a lack of resources and the stigma that surrounds abortion. Women in these situations are forced to choose between a medical emergency and a system it cannot provide the necessary care. Lizzie Presser brought a sobering reality. During a segment on Morning Joe, she interviewed doctors, policy experts, and family members of women who lost their lives. Presser's voice was steady, her questions sharp. What's the risk if a doctor says no emergency? She asked. Experts said preeclampsia can progress rapidly, sometimes in a matter of hours. A delay in treatment can lead to seizures, organ failure, or death. In Tiara's case, no abortion clinic available. The only medical option left was to wait. The crisis had already existed. The conversation didn't stop at medical facts. Presser probed the political angles. Why does the system deny timely care? Is it about money, politics, or something else? Abortion restrictions translate into wait times. Low-income women face these hurdles. Women with chronic illnesses also suffer. Those living in rural areas are also affected. The result is a stark health disparity. Many viewers felt it could be prevented by policy. The segment wrapped up. Presser urged viewers to think about next steps. What can we do to change this? Who has the power to make sure that emergency medical care isn't denied because of a legal loophole? The discussion touched on legislative reforms, increased funding for health clinics, education campaigns to destigmatize abortion. The audience left with sense that discussion was over, and that change would require collective action. In short, the deaths of women like Tiara Walker underscore the urgent need to rethink how our healthcare system addresses abortion and emergency medical care. Subscribe Newspresso. Never miss a major global headline.